This episode is sponsored by Therapy Notes, therapynotes.com. Be sure and check them out and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. And welcome to the Practice of Therapy podcast. This is episode number 287 of the podcast. I'm Gordon Brewer and glad you're with us. Glad you're with me on this journey and hope you're having a good summer, depending on which end of the equator you're on. It's summertime here in Tennessee where I'm recording this from, but I know there are people that are listening that are kind of south of the equator, so it's wintertime there, but anyway, not to get too far off on a tangent, I'm really looking forward to you hearing from my guest, Dr. Brandon Shurn. And Brandon was one of those good people that reached out to me. And after my conversation with Brandon, I was just really blown away. Brandon is one of those people that is so genuine and just really just a real human being. And I think what he brings to our profession is something that is greatly needed. And we talk about the work that he's doing around trauma and really just kind of challenging kind of some of the conventions we have about trauma and really thinking about treating it in a different way, just based on his own experience as a trauma survivor and just all that he's been through in his life. But I'm really looking forward to you hearing from Brandon and what he brings to our profession. He is exactly the kind of person I love talking to on the podcast. And we delve into kind of more the clinical side of things, and I think you're going to learn a lot from Brandon. But before we get to my conversation with Brandon, one of the things that I'm just hearing a lot from people just within the Practice of Therapy community, and particularly on the Circle platform, if you don't know much about that, you can go over to practiceoftherapy.com/community and learn more about how you can join the free community there. But one of the things that has come out of my starting the Psychcraft network of podcasts is just finding people that are interested in starting a podcast. Obviously, you're listening to a podcast now, and one of the things about this is that podcasting, at least in my mind, is really quickly replacing blogging as far as a way for people to consume content. I know that I listen to a lot of podcasts myself, and that's one of the reasons I started this podcast is because it was a way that I was consuming content. But if you've ever thought about having your own podcast, whether it's around what you're doing in your career, or if it's just something that is a topic that you're passionate about, I'd love for you to learn how to do this. As I've always said, if I can learn how to do this, so can you. But what I've done is I've put together what I'm calling the podcasting workshop. And what that is just a free email series that you get from me just by signing up for that. And I take you through all the steps that you need to know in starting a podcast. And so when you sign up for that, you'll get just a short video lesson that'll be emailed to you each day for about 6 or 7 lessons. And that'll give you a good overview of what it takes to start a podcast. And so I've got that out there for you. You can go to practiceoftherapy.com/podcasting workshop. And again, That's practiceoftherapy.com/podcasting workshop, or it might be podcast workshop. Can't remember, but check the show notes here, the show summary, and you can get the link for that. And love for you to sign up for that. The other thing I want to mention here, now that we're in the middle of July, I've got my next cohort of the group practice focus group going to be starting here soon. Already starting to get people to apply to that and sign up for that. And what that focus group is it's really specifically for those of us that have maybe smaller group practices that are also insurance-based. We're kind of a unique niche in that sense, and that we're insurance-based, but also smaller practices. So if you've got 10 or fewer clinicians, this would be a great group for you to join. One of the things that I know just from being involved in other mastermind groups and leading mastermind groups, it's one of the best ways to really get the support you need in your practice. Being a practice owner can be a lonely place. So I would invite you to go over to apply to that. You can go to practiceoftherapy.com/focus group to apply and join the group. And I'm going to limit it to just 8 people so that we can really focus on community with each other. And that way too, when we meet, which we meet twice a month, and you also get access to me to do some one-on-one consulting when we do that. That way, keeping it small gives us all an opportunity to give each other the attention and focus that we need. So anyway, check it out, practiceoftherapy.com/focus group. And so real quickly here, before we get to my conversation with Brandon, I'd love for you to hear from one of the members of the PsychCraft Network and their podcast, and also our sponsor, Therapy Notes.
Hi everyone, I'm Aaron Potratz.
And I'm Nathan Hawkins. If you don't know us yet, we are the voices behind the Shrink Think podcast, which is part of the PsychCraft network of podcasts.
We are so proud to be a part of this network, along with the Practice of Therapy podcast with Gordon Brewer, and the great work he is doing to help people in their journeys.
And if you haven't discovered the Shrink Think podcast, you can find us wherever you listen to your podcast. We love for you to join us as we seek to help you with your relationships, your healthcare practices, and your therapy journey.
Join us as we bridge the gap between clients and therapists. And be sure to check us out at shrinkthink.com/podcast and take our free e-course.
One of the keys to a successful private practice is having the right systems and processes in place to make things run as smoothly as possible. With a system like Therapy Notes, you'll have more time to spend with what matters most, your clients. Therapy Notes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. Your clinical records will be secure with less paperwork, which means you can give a much better quality of care. It's the EHR that Gordon uses in his practice. Be sure to check them out today by going to practiceoftherapy.com/therapy notes, and be sure to use the promo code GORDON to get 2 months free.
Hello, everyone, and welcome again to the podcast. And I'm really excited for you all to get to hear from Brandon Shurn. And Brandon, hopefully I'm saying your last name correctly.
You are.
Good. Well, I'm glad you're here, and I'm looking forward to our conversation and some of the work that Brandon's doing. But Brandon, as I start with everyone, why don't you tell folks a little more about yourself and how you've landed where you've landed?
Okay. Well, I'm Brandon Shurn. How I landed where I am. I have a lot of, it's like a zigzag. I started in law enforcement and then landed in, mental health. And within that, there's a lot of gray and a lot of other crooked paths. But, so it wasn't a straight line to me sitting where I am with people. But my clinical focus over the years, I've been fortunate enough to work with a lot of people, a range of diagnoses and disorders. But the one for me that has been perhaps the most enthralling is trauma. Primarily because, we say trauma, but that's such a vague term, right? We say trauma, but that can mean anything. But the thing that I love about trauma work and working with people who've experienced traumatic events is it's so complex. And it's kind of one of those areas where people just wrote off and said, you're going to forever deal with this. And for me, there's an inner, I like to call it my inner combatant, that drives me to say, okay, you say this is impossible to fully deal with. Challenge accepted. And so I began to dive in. And so I went down a lot of roads, a lot of training, forward-facing trauma, all kinds of trauma, clinical trauma trainings and things like that. And they are good, but there was something missing when I talk about, with all of the training, not taking anything away from them, because I stand on the shoulders of those giants. I just bring my holistic focus to it.
Yes.
And approach it that way.
Yes. This is fascinating to me because, there are a lot of us out there that work with people with trauma, and was something you said before we started recording, just that kind of the approach, and I'm paraphrasing here, has been that we teach people how to kind of white knuckle it through the trauma and the triggers. Yeah.
So it's, what I've seen a lot is let's cope. And so a lot of people come to me and they'll say, give me some coping skills. And it baffles me specifically because I always inquire about whether or not somebody has been in therapy before. And when they say yes, and so I know that's kind of, coping mechanisms and coping skills is what's taught a lot. And so I'm like, okay, well, if you've been in therapy and you've been in therapy for 3 years, you have a whole bunch of coping skills. And so I started seeing this trend, and I'm saying, okay, well, what's missing? It's not the coping skills. They know what to do. Like you were saying, they know how to white knuckle. And I look at it as like, you've been taught how to hold your breath as the waves of life pass you over. But you haven't really been taught how to swim in the ocean of that. Right. And there's a difference. There's a difference with it for me, because if you hold your breath while you're in the water, the only thing you're going to do is walk, and you're going to stay in a safe space, right? So either that's letting the water come up to your neck or up to your breastbone or whatever. But the moment that the waves start, and you can splash and play, and it's like, yeah, I'm out here and I'm doing real good stuff. But you get to the wave starts coming, or you get to a point where the water level now is, up against your nose, and it's kind of going, you retreat, right? You try to get back to safer ground, and you don't learn how to swim like that. And that, for me, that's what a lot of coping skills become. It's like learning how to hold your breath. And, and in that sense, it's this, I'll always be experiencing trauma. I'll always, and so I say, okay, we got to come from a more of an empowering position to help people kind of navigate this thing.
Yeah.
And that's how I ultimately landed on the 5 things. And it's, trying to summarize it in a way to give hope, while at the same time, because if I can instill hope in a person, when we start working, they're going to say, oh, okay, I know. All right. So it's going to affect me different. And we can get into that in a minute if you want to.
Yeah. So, that's fascinating. And you might have already thought of this, but what I'm hearing from you is maybe even we're on the crux or on the edge of a new model being developed here.
Yeah, something like that. I thought about it, but it's like, it's one of those things for me. It's like, I'm learning how to get out my own way, if I'm going to be honest. I'm learning how to get out of my own way and to not hold myself back.
Yeah.
And, and that comes from some stuff and, some
Mhm.
things that I had to work through.
Right.
But,
Right.
and so giving myself
yeah.
more permission is important.
Well, yes, and I would say kudos to that, because I think you're certainly capable of it. So, but anyway, so let's jump in. What are the 5 things?
So I'm going to read them really quickly, and then you can, whichever one stands out to you the most that you want to dive into, we can go from there. So the very first one is understanding that trauma is an emotional response following the experience of a distressing event, right? Mm-hmm. So it's the emotional response to an experience that is distressing for you. Number 2 is your response to the experience often determines the severity. So understanding it's an emotional response and that your response to the experience determines the severity. Number 3 is everyone experiences traumatic events differently. Mm-hmm. And there's a lot of layers to that. 4 is not all experiences of trauma require a diagnosis. And that came from, a lot of people try to seek out a reason or a thing to point at that says this is why. And then 5 is where the summation where, it was going back to where all of the models that I was seeing really wasn't complete. And this is the stains from traumatic experiences can largely be erased. Stains from the traumatic experiences can largely be erased.
All right. Wow, this is great. So I think one of the things that you hit on is, and you might, maybe one question is that comes to mind is just thinking about number 2 there. The response to event determines the severity. And, I think what comes to mind for me, and you expand on this, is when we're faced with something traumatic, our amygdala either causes us to fight, flee, or freeze, right?
Absolutely.
Right.
Absolutely.
So how is it that people experience it in different ways? And what has been what you've learned about this and working with people?
So the response is tied to the perception.
Mm-hmm.
Right? So if I respond to an experience from the standpoint of I've been a victim and I stay in that victimhood, my response, my view is I'm a victim and I'll always be a victim. Mm-hmm. And so now everything is a re-victimization. Mm-hmm. So so that kind of speaks to the clinical side of it, the trigger where you avoid the triggers and you, right? So that's a response to the event. But if you understand that, okay, I had no control over that event, right? Most of the time we really don't. When an event is traumatic, it's outside of our hands. But it's not that. It's focusing on how I respond to it. I don't have to let it ruin my life. I don't have to let it continue to be a dark cloud that hangs over me as I'm walking and I'm trying to do things. And that, if you understand that the event, your response, it may have clouded your judgment, but that's the filter that you use. Mm-hmm. And so if every future experience comes through that same filter, it's dirty. And so you don't have a fresh experience. So this is how we start daisy chaining and things become, kind of, rack and stack, or it becomes layered, very, very layered. And so it's what you do after the fact that impacts the intensity. So if you have an experience, but then your immediate go-to is avoid, like you were talking about the amygdala, and you never allow yourself to integrate that experience, then you're going to constantly be Charles Duhigg wrote the Power of Habit. And he talks about in that book how when we have a reward in response to a stimulus, that behavior that triggered the reward gets strengthened. So if we avoid and we get the reward of not having to deal with whatever that is, right? So we get an immediate kind of release or relief or reprieve from that event, then I'm more likely to engage in that behavior because in past time, that's what worked. And that's where I've noticed a lot of coping skills kind of fall flat because it's dispensed. I jokingly say it's dispensed like Pez, right? We dispense it like Pez, and it's here, do this, do this, do this. And we never give the other side of it. It's do this while you learn how to, right? So the coping skill becomes the flotation device that you use while you're learning to swim. And then once you are confident, then you take the flotation devices off and you say, okay, I'm comfortable enough to swim. Yeah. And now I can navigate these waters a little easier.
Yeah. Can you give us an example of that? How that might look for somebody?
Okay. So let's say you've been in an accident, right? You've been in a what we call a motor vehicle accident. And that's one of the things that we check off on the traumatic experiences kind of checklist. Okay. If you, because of that event and you were the driver, you avoid getting in the car ever again. You've just minimized your ability, your mobility, all kinds of things. You've put yourself in a box, right? Now you become dependent upon others. If you can have you retrain the amygdala to not experience the being behind the wheel as this is going to lead to a car accident, then you do it in a way that kind of lessens the anxiety that is associated with that stimulus being driving, right? And there's a number of ways you can do that. So, from visualization exercises to, saying and experiencing that was a one-off and it's not necessarily going to happen again, right? But it's the filter that you have to, change out. That one experience doesn't equate to it's going to happen every time I get behind the wheel.
Right. So what are you finding that works in helping people change the filter?
Leaning into it. So, because the natural inclination, and this is how you kind of help retrain the amygdala. When the amygdala is designed to keep us safe, right? Right. So it has the ability to override all rationale. You don't think about it. You don't think, oh, that car is coming and it's looked like it's going to drive up on the sidewalk. Should I stay? Should I stay where I'm at? Yeah, if you do that too much, you're probably going to be laying on the pavement, right? So it has the ability to override the rationale or the prefrontal cortex. So in learning and in retraining, you have to lean into it. Learn how to lean into that anxiety and say, okay, what is it about this situation? Not the prior stuff. What is it about this situation that is creating the concern, the fear, the wanting to avoid? Yeah. And now, and while you're doing that, you might employ some coping skills. You might employ some 5, 4, 3, 2, 1. You might employ some grounding. But if you just ground yourself, and you don't experience or say, okay, what am I grounding myself from? Then you're not integrating. You're not challenging the thought, right? And it kind of, so it's kind of some incorporation of cognitive stuff in there where you're questioning all those automatic thoughts, but it's leaning into it, which is the weirdest thing for people. Because you're working against the natural inclination of the amygdala.
Right. Yeah. And so what have you found that helps people do this in the moment? Because it seems like I read or heard somewhere that the amygdala responds 10 times faster than the frontal cortex can even comprehend.
Yep, it does. It does. And so the thing is, and this is where I blend my prior law enforcement training into. Okay. Right. Okay. So a lot of the time we are taught to try to avoid the reminders of a thing. And I push against that because if you do, then you have nothing, you have no basis to really determine how you're going to respond, right?
Mm-hmm.
But in law enforcement, when you do a traffic stop or you're responding to a call, we're taught to think about the possible worst case scenario and what you might do in the event of, right?
Mm-hmm.
So in the event that I experience this, I can do these things. And now what you're doing is you're taking the automatic response and you're kind of turning it on its head, because now you're integrating things that you can do to make it so that you don't run away from it, right?
Mm-hmm.
Same thing with firefighters, right? Like, you got to be really, really brave to just run into a fire. That's not me, which is why I wasn't a firefighter.
Yeah, right. Right.
So, and it's that thing. So it's taking that and saying, okay, so you're running scenarios. And part of what I do in a session is I create safe emergencies. I create safe emergencies. And so I'll do things, not necessarily that creates maybe a trauma reminder for them, but we know that irritability and irritation is one of the outworkings, right? Where your behavior, maybe you have a shorter fuse. And so I can integrate some of that, frustrate you a little bit. Okay, what are you going to do? How are you going to respond? So and so it can create, if you're not careful with it, you can create and rupture a whole bunch of relationships.
Yeah, right.
because most people come to therapy thinking with the idea that this is going to be a safe space for me and it's going to be sterile. And it was specifically when you're working with trauma and traumatic experiences, the sterile environment can create a false sense of security. So you can do the coping skills, you can do the breathing, you can do the grounding, but you have no idea how it's going to work when you're in the moment, which means you don't give your prefrontal cortex anything to work with. So the amygdala is going to kick in and do what it normally does, which is, get you out of harm's way, by any means necessary. Right. I tell folks when, it's like that being dropped into the Amazon. There is when a survival is there is no friend, only foe. Everybody is against me at that point. It's not about, oh, I'm sorry. No, it's like, get out my way, right? It's that I have to survive this. So everything is off the table, right? Civility and all of that stuff. So giving the prefrontal cortex something to work with can help it can help kind of stunt the activity of the amygdala.
Yeah. So there is some credence to the value of kind of exposure therapy to some degree in that traditional sense.
Yes.
Yeah.
And it's just, before I even dive into anything, it's kind of preparing them for what can come. And that's where even with the, I'll say it and I'll say, I might say some things that's going to frustrate you. I might do some things that's going to irritate you. I'm okay with that. I need you to be okay with that. Because if we're going to do the work, the only way to do the work is to have in the present. And this is really from a lot of my training and my theoretical orientation, which is Gestalt, where it's dealing with things in the here and now. And too often we try to deal with things in the past, but it's difficult to do because you're talking at it. You're not bringing it into the now and saying, okay, this is the thing that I'm struggling with about that situation. And you can insert whatever trauma experience that you have there. And then we talk about how to deal with that. And that goes to point 5, where I talk about the stain of it can largely be erased.
Yeah. Tell more about that.
So that's where the hope is infused, right? And that's where empowerment comes from. It's understanding that you don't have to live under the cloud of that thing, whatever it was, right? We call it post-traumatic stress for a reason, but you have to get into your brain that you are not experiencing that anymore.
Mm-hmm.
You might be dealing with the effects of it, and you've creatively adjusted your life to make sense of it, to survive, or to adjust in a way. But the problem is when you continue to stay that way, when there's no longer a need, and it's taking it from the past into the now, so that you can say, okay, this is not something that I no longer need to respond to in such a way. And that's how you begin to remove the stain. The one, and that came from, there was a point in time where tattoos were thought to be permanent and not able to be removed at all. And but then I had some tattoos on my neck. I had one here and one here, and I was able to get them removed. And so the only way a person might know that there was tattoos is if I tell them, because the ink is gone. Right? There's some scarring that you can see from where the ink was, but it's not fully present. And so most people only know if I tell them. And that's the basis of, because a lot of people talk about the trauma experience being a tattoo. And I'm like, well, I've gotten tattoos removed. So I think we can translate that to these trauma experiences as well.
Right. Yeah, one of the things I've said to clients is, and I think with your five things, you hit on this. It's really training your brain how to respond to the amygdala doesn't know the difference between danger and difficult. And so it's training your brain how to respond to difficult situations without it being a dangerous situation.
Yes. And that's the thing. And it pairs with this, a personal maxim of mine. And I kind of talked about it a little bit. It's, you cannot control how life happens to you. You can't control the events that happen to you in life, but you can control how you happen to life. And that's the response. And it takes personal responsibility for that. So I don't, I get really hyperbolic with people, and I say, if you punch me, that doesn't mean that I have to punch you back. I can choose to do that, but that's a personal accountability that I'm saying, I want to do this. Right? I don't have to. I have the option to not do it. Right? I may, because, sometimes people sucker punch you, so you may not be able to stop it, but you can control whether or not you respond. And that's just saying, what do you want to do in these types of situations?
Right. Yeah. And that's the empowerment right there.
Yes. It's giving you back the choice to say, I have the ability to say whether or not this thing continues to run my life. It's scary though, because then you can't stay in that space of victim. You have to take responsibility for it. And sometimes that's where, it's, from what I've seen, a lot of people are afraid of that, to come and say, I'm going to take responsibility for this stuff. I'm going to take responsibility, I don't take responsibility for being raped or being shot or being robbed or, being in a car accident if it wasn't my fault, being T-boned or whatever. I'm not going to take responsibility for that, but I'm going to take responsibility for the things that I do after that. And I'm going to not view it as, oh, well, the world is a scary place and I need to walk around with bubble wrap around myself.
Right. Oh, yeah. This is all truth. It's all truth. Yeah, I love it. Well, Brandon, I've got to be respectful of your time, and I hope we can continue this conversation again.
Absolutely.
Because I think you're onto something that is really good. And what's cool about this, just as an observation, is you've taken the stuff that we know about trauma and how it works in the brain and all of that, and put it in a way that is accessible to people.
That's what I want to do.
Yeah.
And thank you again for allowing me on your platform and speak to your audience and all of that stuff, because
awesome.
it's important. So
yeah. So how can people get in touch with you if they want to connect with you?
Oh, I'm on Instagram at EM Holistic Counseling. I'm on YouTube at EM Holistic Counseling, and I release videos. I call them weekly doses of empowerment. So you could just go to YouTube and search EM or Empower Me Holistic Counseling. You'll see me. On Instagram, it's the same thing. I do this kind of thing of small dose and full dose. So I release small doses on Instagram and like a reel or something, and then I'll have the full dose on YouTube. And then if those are probably the best ways for people to contact me. Or
Awesome.
EM Holistic Counseling is my website.
Okay. And we'll have links in the show notes and the show summary for everybody. And thanks, Brandon, for being here. This is a great conversation.
Thank you.
Well, again, a big thanks to Dr. Brandon Shurn for being on the podcast. And be sure and check out his channels, YouTube, and also on social media with Instagram and the others that he mentioned. We've got links here in the show notes and the show summary for you to get to those quickly. But yeah, Brandon is just a real person, and I appreciate his passion for what he does and really challenging some of the conventional ways we think about trauma and about recovery from trauma, of being able to think about it in a different way. And I really think you're going to probably hear more from Dr. Brandon Shurn here in the future. I think he's onto something that's going to be really valuable to people, and particularly in our space of mental health providers. So, yeah, again, big thanks to Dr. Brandon Shurn for being with me here on the podcast. And also, we want to give a big thanks to our sponsor of the podcast, Therapy Notes. They are the leading electronic health record system for mental health providers. They're who I use in my practice. We had a staff meeting, not to get too long of a story here, but had a staff meeting recently with my staff, and we were talking about the different assessments that Therapy Notes has got built in now, and using those with our clients. So that's one feature that is a newer feature for Therapy Notes, but just really impressive stuff. They're always adding to what they've got there. Their support is second to none. And so I'd love for you to go check them out. And you can do that by going to practiceoftherapy.com/therapy notes. And if you want to try them out for 2 months for free, just use the promo code Gordon, just GORDON, and they'll let you try it out for 2 months for free. And also, as I mentioned at the beginning, I'd love for you to join the group practice focus group, particularly if you've got a small group practice that's insurance-based. That's specifically what this group is for. We meet twice a month in a mastermind style, and then we have a private group on my Circle app where people can have conversations in between our meetings and ask questions. Also, I provide some one-on-one time with people throughout the whole process here with this next cohort. But we when you sign up, it's just for 6 months, and then if you want to continue on, there's a few of the folks that have been in this previous cohort that are continuing on. And it's a great way to build community and get the support of other practice owners that are in the same place in their journey. So I invite you to check that out, practiceoftherapy.com/focus group. And also, if you're thinking about starting a podcast, love for you to sign up for the podcasting workshop. Again, you can go to practiceoftherapy.com/podcasting workshop, and that'll get you on the list. And it's a free offering, and you'll get an email from me each day that'll go through all the steps of starting a podcast. So I'd love for you to join me for that. So take care, folks. Hope your summer is a good one, or winter, whichever side of the equator you're on. And I hope that you'll join me next week for some more conversations with leaders and people in our field. Take care, folks. been listening to the Practice of Therapy podcast with Gordon Brewer, part of the Psychcraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.